Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Welcome to another episode of the Business of America. And again, for our audience and for our guests, and I'll introduce you in a second. We've been talking for about 15, 20 minutes here, having a good time. But the Business of America is it's the arena. Teddy Roosevelt, the man in the arena, the man and woman in the arena, the doers, the makers, those who make things possible, the innovators, the scientists, those who make medicine and therapies accessible, entrepreneurs, moms and dads. We forget sometimes moms and dads are the doers of America. This show is focused on the doers, and I'm excited to have today's guest. We have, and I'll ask her to introduce herself, but Julie Reed, she's the executive director of the Biosimilars Forum, which is very exciting.
It is.
Because I have some background in health and healthcare. I'm the editor of Real Clear Health. And so this is wonderful ideas here for access for patients, for medicine. And of course, I haven't said his name yet, but of course, I've been talking to him for 20 minutes. Jon Martin, he is the head of biosimilar business at Organon. I keep wanting to say Oregon. Do people do that?
The entire state of Oregon. That's
here's
right.
John from Oregon. He's not. He's from Oregon. Organon. And again, he's in this field. This is wonderful science and opportunity and access. I'm a father of five. I'm gonna start here. I'm a father of five. My biggest concern is healthcare. Is access to healthcare. Is affordability. I have 5 children. I have a wife. I'm getting older. I'm gaining weight. So and I'm worried about that big bill, that the healthcare costs. And I'm a political guy too, and I watch the polls. And look, there's lots going on with protests and politics. But you look at the polls, people care about healthcare. It always polls high. In fact, in 2020, certain polls, it was the highest concern was healthcare. And so we're going to have a conversation today about the doers in this healthcare space, biosimilars, and the science here. But let me start with Julie. What's a biosimilar?
Oh, well, thank you. And thanks for having me, Jerry.
And your resume, too.
My resume.
Who are you? Where are you from? Why are you here? Why are you here?
Just Julie, buddy. Just Julie. No, I'm the executive director of the Biosimilars Forum. And the Biosimilars Forum is the trade association representing the U.S. industry for biosimilars. So our members, like John from Organon.
How cool would it be, though, if Organon was in Oregon?
That would be
fun?
cool.
We're in Jersey City.
By the way, the most diverse city in America. I was just in Jersey City 3 weeks ago. A buddy of mine lives there, and I went to a really good pub. And I can't think of the name of it, but it's a famous St. Peter's pub. Okay. Anyway, we'll talk about that. We'll talk about that later. Okay. I'm sorry.
No, this is great. Are you kidding?
Jersey City.
So the Biosimilars Forum, as I said, represents the industry, and our members have the largest number of biosimilars in development at the FDA, the Food and Drug Administration, or on the market here in the U.S. They also have the largest number of biosimilars that have launched and are on the market and around the world. They have brought biosimilars to the entire country and are in market in over 80 countries. So for me, I've been doing biosimilars for at least 15 years, having lobbied for the law to be passed in the beginning and co-founding with some of our members the Biosimilars Forum, because we knew biosimilars was something brand new to the U.S. and it needed, brand new, innovative, and it needed a different perspective from an industry.
Again, we were talking about this off camera about years ago, how we thought, hey, this is different.
Yes.
This is not a generic. This is not an aspirin. And therefore we should treat it and look at it and regulate it perhaps and differently.
Yeah, and it's so exciting. We had a board meeting yesterday, and our members, we talked about how we have created our companies, along with the FDA and along with all of the different folks here in Washington, have created an industry from the ground up.
Yeah.
And it's so exciting because what a biosimilar is, it's heavily regulated. So it'll take a company like Jon's at Organon to develop a biosimilar 7 to 9 years. And what they are is they are copycats of brand biologic drugs.
Sure. But again, just for our audience, and we have a healthcare audience and policy-centric audience. And we've done lots of programs on bio and pharma and medicine and access. But I want both of you to emphasize how it's different or why it's different. It's not a generic. It's not the same thing.
Correct.
And it's and that's important to remember, I think.
Yes. And I think the difference is the complexity. That is, biologics are made from living cells.
Yes, that's. If I had a dinger, I was going to ding that. That's what I wanted to hear. They're living cells. Think about this for a second.
Yeah.
This is the innovation and the science. It's like we live in Star Trek.
Yeah.
It's like you're Dr. McCoy over there. You don't like Star Trek. You're a Star Wars guy. All right, I'm sorry. I like Star Trek.
That's okay. Star Trek is good. It's good. It was all we could watch when I was a kid, so there wasn't a lot on. But so they're made from living cells, and these living cells and the brand drugs are reverse engineered.
Yes.
Something that has never been done before. And so again, the innovation of the science to do these biosimilars is incredible. And what it takes, though, is hundreds of millions of dollars. So this is a significant investment. But it's also, I talk about it from an industry perspective, is men like Jon and these companies, they are making a significant time and money investment to develop a product that will be lower cost for patients and families. That's a societal commitment to bringing competition and lower cost to Americans. That's an incredible investment for these companies and these members. And
what's interesting, Jon, is I'll ask for your resume in a second, but what strikes me as another way this is different, and you said it, you're reverse engineering.
Yes.
Generics is just like, okay, give me the formula and we'll just make it.
Yes, exactly.
This is science, and it cost it cost millions of dollars. It doesn't cost millions of dollars to produce a new generic. Yeah. It does cost. There's a great cost in bringing innovative medicine to the market, and it has its exclusivity, it has its IP, and then it comes off, it goes generic. But this is completely different. And here's and I'll ask about your company and what it does and how it fits in here and who you are. But to me, this is the future of medicine.
Yes.
I joke about Star Trek, but this really is the future of medicine. We're reverse engineering. We're making new therapies, cures, accessible, and again, we don't know what rare disease or what disease we might face in the future. Sure, we know the diseases today. We don't know the next COVID or the next whatever. And this is exciting science. But tell us about you and your company and how it fits in with all this.
Sure. So I'm Jon Martin.
Jon Martin.
I lead the Biosimilars business unit at Organon.
Who, by the way, folks, I know he says he works in Jersey City. He lives in Philadelphia.
I actually live.
Our
U.S. office is right outside of Philly. Although people tell me I don't have a Philly accent.
Where are you from originally?
Hodgepodge. So I grew up in West Virginia and lived down in Atlanta after that.
I'm sorry, where are you from?
I grew up in Detroit. Midwestern.
So I have a really weird accent that comes out at different times. But I would echo your point about the investments need to be made here. We're talking about $200 and $300 million just to get us where we need to be.
Yeah.
And the rewarding part is what we can actually do to address some of the affordability concerns in the U.S. When you look at some of the concerns of healthcare affordability, one of the areas that people lean on or reference is the cost of prescription meds, particularly the innovative ones. Yeah. At the same time, I think the country wants real innovation. They want to see the next gene therapy. They want to see the next breakthrough that could be curative in nature. And one of the ways that the U.S. market can afford those innovations is having a sustainable market that we're talking about today.
Robust, yes, biosimilar sector and generic sector. You know, it's funny. I'll, for full disclosure, I worked at pharma
Sure.
many years ago, many pounds ago. But anyway, I remember Billy Tozen was the president when I had left. He was president, but I had worked under him for 3 years, and he had said something that really stuck with me all these years. He said, "Look," he goes, "yes, Americans want the innovation, but we're not making ice cream here, and this is necessary for life, and so therefore it's on us, the innovators and the scientists and those involved in the public health community and in the academic community and those, you know, reverse engineering, doing all this work, we have to make these things affordable. We have to. It's a moral imperative. You said societal. It's a moral imperative that we bring therapies to market to save lives and improve lives. This is exciting. I'm not kidding you. This is exciting
cool
stuff.
Those of us in those companies that are competing in this space, I think we've done a lot to demonstrate that. You can look at multiple categories, multiple products where you compare current price versus trends, we're at 60, 70, 80% of the cost we historically had been. And when you think about that value going back into the U.S. market to be able to be reinvested in innovation, other healthcare, other forms of healthcare, that's a real exciting reason to be in this space. If you think about the biosimilars over time, over the next 5 years, every 3 to 5 years, the opportunity for savings doubles. So
Wow. I say that again. Every 5 years.
It'll double.
It'll double.
So we're just at the beginning of what can be a real breakthrough in affordability for us.
And think about this too. These are, in many instances, therapies you can take in your doctor's office, and we're moving toward, I think, where we can take these innovations at home as well, sort of thing. They're mostly injectables, right?
Yes, okay. Absolutely.
So they're injectables. Now think about that though. I don't have to spend a week in the hospital. I don't have to be away from my job or my family. And also, I mean, for those with chronic conditions, sometimes a long hospital stay is dangerous. I mean, because you might have other issues that are not looked after, or so the idea that you can be in and out, so to speak. I know it's not that simple, but the fact that this makes medicine more personal, makes these therapies and access to these therapies more personal, also is cost saving. It saves the economy money.
Yeah, I think there's. So I want to be careful saying that we can avoid people going to the hospital.
No, I don't know. I don't mean to say that, but I just my again, maybe I'm. You know, it's whatever's on your mind, right? You know, and my father just spent a week in the hospital. He had to go in for a cardiovascular issue, and he's older. My dad's 80. Sorry, Dad, I'm gonna give you your age. My pop's gonna be 86, and he was in the hospital toward the end of his hospital stay. He was like, "Hey kid, where am I again? Like, why don't?" And like, he's not that way at home. So my point is that it would have been better for him if he had taken his medicines when he was, you know, younger and didn't have to go in for the cardiovascular work. That's my point.
I'm sorry, Julie, but the promise of what we're trying to deliver is more affordable healthcare for every stakeholder. Sometimes that drives to the patients, and what we've seen in certain categories is some of these prices are 80, 85% less.
Wow.
That value flows to patients. This competition that we just talked about with 60 and 70% reduction from trend, patients are asked to pay a copay of whatever the reimbursement amount is. That flows to patients. So the system saves, the patients save, employers save, and it becomes a real opportunity for the entire ecosystem to benefit.
So how long have biosimilars been in the market, and how long has your company been in existence?
So we're a product of a spin from Merck, and so we underneath Merck we launched 2 biosimilars. We now currently have 3 and a few more to come. We've been in the space since 2017. And so we were one of the I don't want to call us the pioneer, but we were one of the earlier players in the space, and so we've learned a lot. I think all the early players had a certain way that they thought this market would work. You kind of go into this space a bit altruistic, that you have a lower cost product. People will use a lower cost product. It doesn't always work that way, right? And so what we've learned over time is that every stakeholder's definition of value may not be the same. And we've been working with Julie and other stakeholders to say, how can we better align the incentives so that people want to actually use a lower price therapy?
Now, is it also like education or just lack of knowledge? A question for both of you is, and we alluded to this already, but how are they're living organisms, but if you were to talk to Jerry patient, what's the difference between for your health and for the cost? What's the difference between a generic and a biosimilar?
Okay, you want me to take that one? Well, I think, as you said earlier, Jerry, the generic is a small molecule.
Yes.
And I describe it, as you said, like, give me the formula, give me the recipe. And, I see it sort of like organic chem, the oxygen or the carbon is connected to this, is connected to that. And it's usually a solid form. So it's a pill.
Yes.
Okay. And they've been around, thankfully, for 40 years and have saved, I think, over $1 trillion in that time frame. Now, a biosimilar and a biologic is made from a living organism. Yes. And so we're looking at DNA and to make a biosimilar and reverse engineer it and show the FDA, who is the gold standard around the world of regulatory science and things like that, that this product is safe. And I have to say, FDA just approved their 50th biosimilar in the U.S. They have published a paper that all the biosimilars, they have not seen any adverse events or safety issues with any biosimilar here in the U.S. and really around the world. We have probably tens of billions of patients and days where patients have used a biosimilar around the world. And because of the stringent science and regulations that we follow, they're safe, they're effective, and extremely important, as Jon has said, they're lower cost. But it takes, as Jon said, hundreds of clinical tests, looking at the structure of the biosimilar, comparing it to the brand over years before the FDA will approve. And that is, you can make a small molecule generic in 1 to 3 years, and the cost is maybe $1 to $3 million.
Sure.
A biosimilar, because of the rigor of the science, takes 6 to 9 years and cost hundreds of millions of dollars.
Yeah.
So, but we do it. We do it because we believe in competition, and we believe in patient and family access to lower cost products. So
let me ask you this. I do want to know, what you can talk about exciting that's coming out of your company or areas you're working. But before that, because you've said something a couple of times, and for some of our listeners and viewers, it's going to be counterintuitive. And that is the regulators and the science, the regulations and the competition.
Yeah.
In the healthcare space, this is one of the best policy areas where the ideological stuff you throw out the window.
Yes.
Because it is a public-private partnership.
Yes.
Because there is innovation and competition, but there's also the need for regulation and access. And so the last 20, 25 years, some of the greatest, what conservatives would say, market reforms in healthcare have been these cooperation between the government and private industry.
Yep.
Operation Warp Speed, right?
Yeah.
The Medicare Modernization Act is a public-private partnership. So talk about that a little bit, about how this is not ideological, this is not political, this is science and good regulations, the gold standard, you said. Talk about how the scientists and the investors and the company and the regulators have brought this industry, birthed this industry, so to speak.
Go ahead.
All right. Well, and thank you for that. I think the entire pharma industry, folks don't understand what a commitment they have made, including our biosimilar industry, to create something from scratch in the generic drug industry. First of all, the innovation side. It's so important to have innovative medicines. And I think we take that for granted in this country. Yeah. I'm a former cancer patient and I'm sitting here today. And as parents, we can say, my God, we are so grateful that if something was to happen to our children or our families, there may be medicine that will help them. And I think that's so important. But also, our companies and on this side of it say, yes, we believe in a robust, innovative market, and it does cost money to bring innovation. We also believe in competition. When that intellectual property and those patents expire, we want to bring a lower cost product a safe and lower cost product to the market. At the same time, having robust competition, because then we save the patients and their families and taxpayers billions of dollars.
Yeah, we protect the word innovation in this industry
Yes.
a little bit, right? So people will often say there's a biosimilar in the innovator, and we're quick to correct it.
Notice I didn't say that. However, I have used that phraseology when talking about the generics and the innovative companies. But I know that. But explain to me why that's true.
So we protect that word in this industry.
Yes.
We don't allow it to be the biosimilars and the innovators, because there's innovation in what we do, in the how that we bring these products to market. There's innovation in the manufacturing processes. There's innovation in the characterization processes. There's innovation in elements of the products beyond the molecule. If you have a device or something, there's often innovation in your devices. And so we're really careful to protect that word, because in our space, we think there's innovation on both sides.
Yeah, well, I mean, the reverse engineering.
Yes.
The Star Trek thing fell flat, but I'm sticking with it. Like a good comedian with a bit. You can't let go of the bit. But Project Genesis in one of the movies, it seems to me that every time you do your job, there's a Project Genesis. You're creating something, even though there was the biologic, you still have to reverse engineer it. This is a creative process.
Yes.
Which makes it completely different than the generic versus whatever.
That completely different process, go back to one of your earlier questions, reinforces some of the need for education.
Yes.
And one of the things that we've seen, the FDA has taken a really progressive stance here to help make people feel more comfortable with what these molecules are. Every manufacturer is making significant investments to educate every stakeholder, a pharmacist, a physician, a patient, on what is a biosimilar, how their product is similar in nature. And you see pharmacy associations doing the same kind of thing. So there's a lot of large stakeholders reinforcing education, because again, we're at the beginning stages of what will be a viable market to produce significant savings that ultimately will help address part of the affordability concerns in the U.S. And so everyone, I think, is aligned in the mission. It's just, how can we achieve that mission?
Yeah.
It's interesting, and this is off topic in a sense, but in the news, there's lots of news stories, and whether it's Page 6 or whether it's in Politico or whether it's in Nature, or in a journal, about the weight loss. And these are biologics.
Yes.
That has gone a long way in making the public understand what these things are. I worked in this industry for years, and very, in cancer, of course, but you wouldn't meet someone like, hey, I'm on a biologic,
Yeah.
But now I run into people all the time who are doing the biologic thing. So it has even though it might be a different product, different company, has that helped, the focus on this, has that helped educate the public about what biologics and biosimilars are?
I think that that particular product is very unique to the education we've done on biosimilars. And we started, the first biosimilar was launched in the U.S. and approved in 2015. So we're still...
That's amazing to me.
We're still kind of young.
You're an early company in this space, and it's 2017. I mean...
Yeah.
I think I bought this jacket in 2017. You know what I mean?
It's a
I
little
was so
more
much
fashion
younger
forward.
back then.
I appreciate the reference.
but you get my point. This is
It's
this is
nascent.
amazing, and
Yeah.
think about the progress made in a very short period of time.
Yes. Yeah. And well, when we were first launching biosimilars in the U.S., unfortunately, there was so much misinformation. There was fear mongering, and very, very similar
That's
to what
interesting.
happened
Yeah.
to when small molecule generics were launching. Like, it's a generic, it can't, So
Sure.
we spend incredible amount of time as companies educating patients and doctors and working closely with the FDA. The FDA, they knew we had to do grassroots education and research and publication to get to the point where patients are like,
big job.
oh, biosimilar. Physicians are like, biosimilars, that's what we want to use. And we believe they're safe and the same as the brand. And as Jon said, if we get access to the marketplace, if we can have competition, economists have predicted biosimilars in the next 5 years alone, Jerry, over $130 billion in savings.
Then double that every 5 years.
Yeah, now double that.
So what's happening at your company that is you can talk about that's exciting that?
So we're really excited. We have 3 products in the market today. We started in 2017, and we compete in both the immunology space as well as the cancer space. And so we see the differences of acceptance of biosimilars across different patient types, and for that matter, across different physician types. And some of that is just driven by what is available to doctors. And so in some of our markets, we see 85% of the potential is already in a biosimilar, which I think speaks volumes to what those stakeholders believe that in terms of savings, it could be significant. Others, there are inherent kind of hurdles that we have to work through perverse incentives. But I think everyone in our organization is optimistic about what the future can be. And then we have additional products coming. We've announced 2 other products that are coming with potentially even more in the future. So we're at the beginning of what we think is a long-term play for Organon being one of its strategic pillars, and we're really excited about what the future could be.
Again, one of my favorite movies is Moonstruck. You ever seen Moonstruck?
Yes.
You must. Have you seen it?
Your wife
my Star Trek thing went south, and now the Moonstruck. I actually think you were offended by my Star Trek. No, but there's a line in there's a line in Moonstruck.
I got movies to watch.
My wife says this to me a lot when I say something smart, and you've both said something smart here. Lots of smart things. Yet you have a head for knowing things. This is exciting stuff. I could go on for another hour or more. No, we gotta get out of here, Jerry. But this is exciting science. It's exciting accessibility for healthcare. Everyone's concerned about cost. I'm sorry.
Yes.
Democrats, Republicans, big people, small people. I mean, it doesn't make a difference your walk of life. Everyone is concerned about healthcare costs.
Yep.
What did I miss? Is there something that you want our audience, our listeners, to hear, or just to get a sense of who the audience is? It's a very real, clear audience. It's shared real estate. So as many Democrats as Republicans listen and watch the show, it's a lot of folks in D.C., but also folks in media. It helps that I have the real clear family, because a lot of the folks who read what we do love this Federal Newswire newsletter. So understanding the shared real estate here, is there something we missed or something that you want to emphasize before we say goodbye?
So I won't say that we missed anything, but I will just say what an exciting time it is to be in this space.
Yep.
And I can't speak for other companies that are in this space, but I know most companies that are in this space are committed to be in this space. The commitment that we see is about bringing more affordability, improving patient affordability becomes a common theme. And having a long-term viable, sustainable market here is really important. And to enable that, there's probably going to have to be some policy changes to help support it.
Okay.
And I'll build on that to say, and build on what you said, Jerry. This is a very exciting time. Patients and families and consumers should be excited. The support for biosimilars is non-political. It's bipartisan.
Yes.
Every administration in the last 15 years has worked, or 10 years has worked closely with us. Every bill we've introduced for policy changes has had bipartisan support.
I got to interrupt you for a second, because that is the unicorn.
Yes.
We live in times now, and
Yes.
I'm in D.C. and I work in D.C.
Yes.
and I deal with politicians and policy. It is so difficult to get D's and R's. Not even just D's and R's. Just anyone to agree on anything.
Yes.
And the fact that we can get bipartisan cooperation here, that makes me an optimist.
When you talk about it in
Yes.
person, like you said, in this
Yeah.
town, but for the last 10 years, bipartisan support. But what we have to do is get them over that's the hard part, is get them over the finish line.
I've noticed, and again, and thank you so much. This is really, truly has been such a great conversation. I do work in healthcare mostly. Healthcare policy is like where I started. But I am a jack of all trades, master of none. I'm a policy guy. But the one area that I've noticed lately, in other words, in the last 4 years, there is agreement in healthcare, specific healthcare issues, and that to me is encouraging, because I think this is the most important policy area, in the sense that how much of the economy, the concern of the American people, the importance of access and new therapies for the future. I mean, if COVID didn't teach us anything, it taught us that we have to be ready, and this is important. So thank you very, very much.
Thank you.
Thank you,
I
Jerry.
hope to have you back. I say this all the time, and I'm going to say it again because it's true. So I'll tell you a quick story first. So my grandma was a great cook. An Irish woman, unusual. My mom, I love you. You're not a great cook. Grandma's. My mom boiled a good potato. Anyway, but my grandmother was a good cook. And my grandfather, they're from Ireland, he'd come, "Oh, Catherine, that was the best meal I ever had." And she'd get angry. "Well, what about last night's meal? What about, why, how could everyone? This is the best show we ever had." And I do say that all the time, because I do think every show is the best show. And thank you so much.
Thank you.
And we'll be back. For our audience, another episode of The Business of America. We are blessed to have these conversations. Thank you very much.
Thank you,
Thank you.
Jerry, so much.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream